Good afternoon, everyone. My name is Josie Goronsky, and I worked in the veterinary industry for just over 20 years before coming to PetSecure Pet Health Insurance as their business development representative. PetSecure is proud, to be a longtime sponsor of Animal Health Week and to bring you today's 4th annual webinar. This year's theme, It Takes a Team to Protect Your Animal's Health and You, is designed to raise awareness about the importance of animal healthcare teams and the valuable role each team member plays in protecting animal health and wellness. Today, we are going to hear from registered veterinary technician Becky Taylor, who will discuss workforce woes, thinking inside the box. Becky describes herself as a vintage RVT, having been in the profession for over 30 years. She has worked in practice, education, industry, and now operates her own business, BS Communication Strategies, where she coaches and teaches individuals, teams, and students. She has participated provincially, nationally, and internationally in the leading of veterinary medicine and is a strong advocate for the role of technologists. Becky completed an MA in professional communication in 2016, which propelled her to start her own business coaching and teaching people to enhance their communication skills. She is the founder of Mobilizing RVTs, and is often referred to as the disruptor for her innovative approaches for leading change. Without further ado, I give you Becky Taylor.
Thank you so much, Josie, and welcome everyone to what I hope will be an engaging and an interesting webinar for us all. I really want to thank the CVMA for inviting me to participate in this way, and also for, I think, this year's theme being one of the best that I've seen. It takes a team, and I certainly wholeheartedly believe that and have believed in that in my entire career as a vintage RVT. So this is my 30th year in the veterinary profession, and I'm pretty excited to be here presenting this. So thank you, everyone. And I really want to encourage folks to be active in the chat. I know that there's going to be some folks moderating, and I always enjoy a really great dialogue. So anytime that we can have conversation and be engaged with each other really is really soul-filling for me. So please, if there's comments or questions, I would love to hear from any of you, and please add your comments to the chat. So we're going to get started. And I really love the RVTTC, which I've been a big part of, and I am very proud to be an RVT, and even at my vintage level now. This is just upcoming events. This is my plug for my business. If you're interested in more, please give it a look. Okay. So what I want to do here is I want to just kind of outline, this is what we're going to be talking about today. So the title that Josie had said was Workforce Woes, and I kind of feel like that is the environment that we're in right now in veterinary medicine. And there's the old sort of a familiar business saying of thinking outside the box, but I really got stewing and thinking about this presentation and thinking about the veterinary industry, as I do all the time. And I think it's time that we don't need to look outside the box. I think we need to look inside to our own teams and see what's going on. And of course, I'm going to talk about a program I've created called Mobilizing RVT, and where that stemmed from, and why I think it can be of benefit. Not just the program itself, that is regardless of whether a person is interested in that, but the thinking behind it and the innovation to do exactly what this topic is talking about, which is looking inside the box. So we're going to look at opportunities for RVTs, and we're going to talk about sort of what's going on right now. We're going to look at what is mobilizing RVTs, and it's not even the program, it's the concept of how we engage, empower, whatever terminology we want to use with our team. And I know our teams are getting very big now. I mean, we're not it's not a 3-person deal anymore. The teams are huge. All the roles for everyone are diversifying and becoming expanded, and that itself adds its own challenges. So I'm going to really challenge leaders in this webinar, and any veterinary leaders that I talk to, and I would argue that we're all leaders in some fashion, but I'm really going to challenge the leaders of our profession, leaders within practice, the thought leaders, all those things, to really start thinking about investing in changing culture and leading change. And of course, I can't do any of these presentations without talking about the value of learning to communicate better. And then we'll talk about some challenges and solutions of engaging RVTs. And I'm going to share some of the insights and challenges that RVTs that have done the Mobilizing RVT program, kind of where they're at and some of their comments. So one thing folks that know me, or I hope we're going to chuckle behind the camera here, but I really want to change this narrative around RVTs, technicians, whatever province you're in and whatever terminology you use for, I'm going to use RVTs, since that's what we're using here in Alberta. But I want to think about the concept of mobilizing or activating RVTs. And I chose the word mobilizing because it really means about marshaling resources for action. It means moving towards action. It means doing something with a group that's ready to do it. And I'm really trying to defeat the word utilize, or to just really challenge everyone to not use the term utilization. And honestly, I've read veterinary magazines from the 70s that were talking about underutilization, not utilizing them enough. I mean, we've been using this verbiage for way too long, and it doesn't really mean anything, I think, significantly to the role or to the professionalism or to the way that RVTs can start actively engaging with clients in a more significant way. So I personally am not using the term utilization or utilize anymore. I think the term utilizing something means something is being used. And I don't feel like that's what we're doing here anymore. So that's my, I'm trying to change the own narrative by eliminating the use of that word. So we want to talk about how we can start using and using the strategies that we have learned, and think about how we can adopt different processes or different attitudes or different thinking around what we're currently doing. And that's the looking inside the box that I'm talking about. So I put this up here. This was the result of my MA program that I completed in 2016 in professional communication. And of course, it was the only one in my whole cohort that was, from the veterinary profession. And my whole study on this final project was around the role in my study. I used the term AHT, but really what I talked about is communication skills being utilized, not AHTs being utilized, and to support this relationship-centered care model. And there's, for folks that, what a real inspiration for me when I started down the road of my MA, and what I had been seeing before that, was the evidence behind the role of communication in medicine. And so that was a real inspiration. There's all tons of citations. We've been studying communication in veterinary medicine for, I think, about 20 or 25 years. In human medicine, it's probably over 50. But very little has been talked about the role of any of the supporting staff or the paraprofessionals, whatever terminology you want to use for the role of RVT. So this was the first, when I went hunting, there was maybe 4 active peer-reviewed articles that really spoke about the role of RVT. So the result of my research really created a bit of a communication model. But at the end of the day, when I looked at how RVTs were communicating with clients, we're taking history, we're getting information, we're providing some education to them, and we're providing some support. So that was the sort of the basis of, sort of what came about from my study and from my research. And what I really also see is how increased skills leads to increased competence, which then leads to increased confidence. And I do know that when we're in a healthcare setting, what people, clients in our case, patients in human medicine, what they want is someone with confidence so that they can trust that person. And I don't mean false confidence. I mean the real confidence that comes from building your skill, increasing your competence, and having that confidence. So I don't know how many folks are on the call here, how many folks would be interested in popping something in the chat or whatever, but really, really challenge people to think this. What are the current, your own personal view, current most prevalent thoughts around the roles of RVTs in practice? And if I were to ask you, what are your RVTs doing? I don't need the task list. Okay. And we have endless lists of tasks for everybody in a veterinary practice to do. But I want you to say, to finish this sentence, and I hope that some people will put some comments in the chat. Finish the sentence to below. The RVTs in my practice spend most of their time. I want to know. And Josie or someone, if you can let me know what folks are saying, but I'd really like to hear people comment and talk about what do they spend most of their time doing. And the reason I ask this is when I was working actually with Mosaic Veterinary Partners, one of the things that I interestingly asked the managers to do at one point was to do their own little ethogram of, I said, take your week in 15-minute blocks and actually put in there what it is you're doing. Again, I don't mean the endless list of tasks. In every 15 minutes, I asked the managers to tell me what specifically over the course of a week, what they did in 15-minute increments over their Monday to Friday or their 40 or their 60-hour work week or whatever it was. And I encourage you to do this with your RVTs as well, because most people may have an assumption or what they think they're doing, but when the rubber hits the road and you start actually tallying it up, you'd be surprised to find out what people are actually doing. So I did it like a little behavior ethogram and had people chart it that way. So I encourage you to do that.
Becky, did you want me to read out some of the answers?
Yeah, please do.
So we've got talking to clients, patient care, anesthesia and post-op care, treating patients, assisting the DVMs, supporting clients, anesthesia, vaccination, wellness appointments, assisting veterinarians' general needs, patient care communication, and so on.
Love it. So I love that. I mean, those are all things that, of course, we should be doing. I mean, that's not terribly surprising, but I encourage you, RVTs that are on this call, and veterinarians or leaders, whoever it is that you're in your practice, to actually do a little ethogram of what you're actually doing. What are you doing in your workday over a period of 5 or 7 days or whatever your typical time is, and actually take a good solid look at what it is that you're doing. You may be surprised. It may validate me, like, you know what? I literally spend 70% of my time monitoring anesthesia. That's a win if that's what you want to be doing, if that's the best place for you to be in that practice. So that's my throwdown. My challenge to everyone is to take a look at that and ask yourself, here's what I think I'm doing. And this is what happened with the managers in the Mosaic practice. They're like, no, I'm pretty sure I'm spending all my time doing this. When they actually looked at, looked it up, it was somewhat different. So I really encourage everybody to take a look at that, because I think, there's solid value in getting the data and doing a little bit of action research, for yourself and finding out where it is that you think people, what they're doing. So I hope you'll do that. And thanks for adding into that. So you've heard me mention already a little bit about, what is the role, or because we're talking about diversification of team and what it is that we could be doing. And I think it's really important to recognize that all of us have, we have a lot of tasks to do. And when I look at a lot, and I've looked at a lot of job descriptions, as I'm sure many of you have, that when I look at someone's job descriptions, I look at it seems like it's an endless list of tasks. So it's not really in my mind anymore when I think about, the team. I mean, yes, there's stuff that needs to get done. Don't get me wrong. I know shit needs to get done every day in a veterinary practice. We know that there's a long list of things to do, but I really want us to start thinking away from the list of tasks that need to be done. We have an essential task list that the ABVMA has created. The CVMA has a list of competencies, which is a list of tasks. So while those things need to be done, I think we need to start thinking more in the realm of greater responsibility, of engagement, of adding value, of all these things that we talk about sort of in a bigger perspective. But I think we need to look inward and really get to it. It was a definition of the CVMA. Here it says, as animal welfare advocates, some of the important tasks carried out by RVT. So this is language that we've been living with. There's the industry definitions of RVTs or AHTs all over. This is the Veterinary Professions Act. This is not new to anyone that's been studying regulation. So we've been around for a significant amount of time, but I think the definitions of what we do is really around the realm, or in the realm of task doing. And I think we need to start expanding that and expanding our thinking and the way that we stew about that. Here it says, again, has met all the requirements. And again, there's a long list of tasks that we can do that support what it is that we're doing in veterinary medicine. So my challenge again to everyone is to start thinking beyond this, beyond the task list, beyond the competencies, and really to start, I don't know, challenging our own selves and how and what we've been thinking. So this is a 2021. I know we've got a recent one, but I really am starting to enjoy, and again, would love to hear folks' comments here in the chat about this specifically, that there is now getting a bit of a lens turned on this role. So, on the one hand, again, when I think about the term utilization, I've been hearing underutilized, underpaid, we've been hearing those things for many years. I think there's a focus now being put on that. So I like that we're sort of expanding our eyes. We're looking at what it is the role. This one is specifically on wages, which is of course important to all of us. I just jokingly here, when I do workshops with veterinary teams, and if there's any of you in the room, you can let me know if you've heard this before, but in regards to wages and money and talking money with clients, this is the chant that I wish every veterinary practice would start every day with. I'd like everybody to put their hands in. I'd literally say, we're in it for the money. Because I think we need to get more comfortable with that so that we can talk more proactively about wages, so that that isn't something that's in our narrative all the time. This is something that the OAVT did. Again, I encourage you to look it up. This is just showing some of the things they're talking about. Here again, terminology. How well are RVTs being used? And what they were focusing on too was there some revenue generation? Was there some things that, ways that RVTs that can contribute? So I love that we're getting into the meat of what it is that we can do. Here's another one done in coordination with Dr. Jason Coe, and you can see Rebecca Rose, CBT was on here. Really great white paper and study done on sort of this concept of team training, team satisfaction. And they were really looking at, you can see the title there, quality, team satisfaction, quality patient care, and profitability. We're in it for the money. So really that's what we all of us need to start thinking of, and not just, when I say we're in it for the money, I don't mean let's rip people off. I mean, let's add value. Let's be comfortable with what it is that we're doing. This is new. I don't know if we can do a little show of hands. How many folks have seen this? This is just recently come out. Is there any comments in the chat, or if you can show a little show of hands? How many people have seen this? So does anyone know what my issue is going to be with this particular thing? I love the study of it, but of course it's AHA technician utilization guidelines. I did almost have a little cry when I saw that, but the rest of it is really quite excellent in what it is. And here, of course, in the States, they're talking about credentialed versus non-credentialed RVTs, but they're talking about the same damn things that we've been talking about for 30 years. That proper utilization is crucial for optimizing team efficiency, which in turn increases access to veterinary services, patient care, and addresses staffing and retention problems. I know we're talking about the same thing over and over. We've been talking about this for my entire career so far, 30 years. And so I just really, I love everything about this, but my only eyebrow raised like that would be in the term of utilization. So this is worth looking at it. There's some really good resources as part of this. And I think, again, we're trying to shed some light here on not just more tasks, more things to do, get more busy, add more things, add more things, add more things. So that is very tiring for all of us. But this is a really good resource for folks. So I hope if you haven't looked at it, that you do take some time to put your eyes on it and see, what of it that you can take away. The workflow roles that they've got in there are quite good. There's some assessment tools. Again, you can see all the things that are in there. It's a pretty good resource, and I think it's worth spending some time looking at. If anyone has a comment, if they've already read that, or if they have a comment on any of the resources, I'd love to hear it, or we can chat about it later. But I'm really thrilled that there's, again, more of a lens getting focused on what it is that we've got going on here, and what this is sort of expanding the role, expanding the thinking, and getting away from the task list that I think we've been really living through a lot. So I want to talk a little bit, this is the concept of strengths-based team, because this particular talk here is about, looking inside the box. And of course, I'm focused on RVTs, but I know our teams are bigger. We've got reception and client care and client service representatives. We have tech assistants or TAs or kennel help or people that are supporting husbandry. We have oftentimes people that are in a management or supervisory role now that may or may not be from the veterinary profession. We have human resource folks now that are integrating into practices and being contracted. And of course, the veterinarians are still doing all the magical things that they've been doing for many years, which is trying to balance this great medicine, this great client service, the running of the business, the value add, the mentoring, it's a heap of responsibility that we put on the veterinarians, and the team really is designed, as in my mind, as it always has been, to support the great work that the veterinarians do. So when I think about the best teams, and even with my own team and my own business and teams that I've worked with, I really want to look inward and say, okay, what is the strengths-based team? And to me, it's that second bullet point that you see here. It's doing what you like and what you're good at most of the time. That's my simplest version for team success. So doing what you like and doing what you're good at most of the time. And what I see happening when we do that, and that doesn't mean that we can't go clean a poopy kennel if one presents itself and we're there. It doesn't matter who we are. So I know that that's not something like, oh, I really like doing that and I'm really good at it and I wish I could do that more. I know that's not generally, in that particular case, but a strengths-based team to me is one where everybody's operating at a high level. And the reason it's a high level for most people is because it's something they like. And because it's something they like, they've tried to get really good at it. And I hope that's resonating with lots of people, because to me, that's a really important thing that as team and leaders that we kind of miss out on. We just go, oh, you're the RVT, you're going to do this task list. You're the TA, you're going to do this task list. I think this inward look really means that we're looking to our teams. And I did this with performance reviews with many people. I did my own performance reviews when I worked at Olds College. I literally created my own self-assessment where I was asking myself, what are the things that I'm really good at? Not which tasks I can do really quickly. What are the things that I'm really good at? And then I asked myself, why am I good at them? So clearly communication was one of those things that I felt like I was pretty good at, and I wanted to pursue it more. And even when I'm at the level that I'm at now, I still pursue it even more. I still take in the study of communication. I still want to learn more and add more, and not because I'm looking at it like, oh, I wish I could get better at this because I'm not good at it. But our strengths-based team concept is about looking at what people are good at and asking them to get even better yet. That's a term that we use in University Calgary when we're coaching the professional skills for veterinary students. It's called EBY. It's even better yet. What can we do next that's even better yet than what we just did? And I think sometimes we don't go into the strengths-based team focus. Again, if I was in a room, I'd say, how many people have gone into a performance review or an evaluation or assessment somehow of your behavior or performance at work and have been asked, what are your strengths? Great. And what are you things you need to improve? And then the rest of the conversation is talking about the things that you need to improve. Here's my philosophy on that. Yes, we should be competent, entry-level competent at the things that we need to do. So if we have tasks, if we have processes, we need to be entry-level competent at those things, of course, and in credentials. And, for veterinarians, for RVTs that need to have a required level of education or understanding, of course, we have those things. But the next piece of that is to say, what is the things that you're really good at, that you really like, that you wish you could spend more time doing? And when I started asking team members that, and I've asked many people that, it's very, very interesting what happens. If you watch, they brighten up, they start talking about the thing that they're super nerdy about. They start engaging in whatever part or whatever role it is that they're doing. And then you ask them, well, what could you do? What do you want to do to be even better yet? And that's the focus that we need to put on all of our teams. It doesn't mean, okay, you only are good at these 3 things. That's all you're going to do and forget about the rest of your task list. This is not what I'm suggesting. I'm thinking we need to look more inward. And here's what happens in a really great strengths-based team. Exactly what I said. Everybody's doing what they like and what they're good at most of the time. If we applied the 80-20 rule here, if 80% of the time I was doing things I was very good at, I was highly skilled, and I enjoyed. So the other 20%, there's going to be tasks that I need to do that need to get done, and I'll do them well. But they're not going to meet my highest level of skill or my highest level of interest or my highest level of enthusiasm. So this is a question that we need to start, again, when I say look inside the box, what is going on right inside your own team? And is everybody doing what they're good at and what they like most of the time? Here's what happens when people are in that state. Then you start seeing a joyful workplace. You start seeing people that are highly engaged. You start seeing improved efficiencies. These are all things. What is very difficult is when we are tasked to doing something that we need to improve and working on something. And again, the reason we're probably not good at it is not because we're unskilled. It's probably because we don't like it, or it doesn't activate our interest or enthusiasm. So I think this is the balance that we need to think about. And as team members, we need to look at that for ourselves. As leaders and people that are responsible for the performance of other people, we need to start looking at that. So when I think about a strengths-based team, I want to look around the room and I want to ask people, are you doing what you like and what you're good at most of the time? And I want people to be so good at the things that they love and the things that they're good at, that they can then encourage and coach others, so that others that maybe isn't their skill set or isn't their area of interest, that we can get them up to an entry level or an entry or a competency. But we can't have 17 people that are all excellent at the same thing. But you start encouraging the excellence in the responsibilities or roles of the few people so that they can train and mentor the ones and get them up to, and pretty soon you've got a very dynamic situation there where people are operating at their highest level. And I hope that folks are doing that already. And I think there are practices, but I think as part of your formal assessment, as part of your team meetings, that it's really, we need to start looking around the room and say, what do you do? What do you like to do best? What are you good at? How are we going to get it so that you're even better? Yeah. What would that take? What would be the investment of our time, energy, and resources? So I hope that gets some people thinking about how you're going to look at your teams a little bit differently. And again, this was so relevant because, of course, this is the focus of this week, is our theme for this year is It Takes a Team. So, of course, part of the thing that I think about with when I think about teams as well is this last bullet where it says effective team equals better care and prosperity. And this concept of we have to stop assuming that everyone knows how to behave on a team. So everyone can do their tasks and everyone can get their list done, but it's how we behave on a team and with each other that oftentimes needs to be fostered and developed and trained and educated. So this is, of course, where communication comes in. I can't really talk about anything without nerding out a little bit about communication and how important that is. But communication now, and specifically interpersonal skills and dialogue, really it's a skills-based approach now that we can use. So remember what I said earlier, increase our skills, increase our competence, elevate our confidence, and suddenly now we're a magnet for other people. So, and leaders, you have to set the example. You are, so a leader to me is someone that is a thought leader or a behavior leader, the one that people look to and say, I'd like to behave a little bit more like that. Not necessarily the one always that has the title or signs the check. And, but I think when you look at your thought leaders and your behavior leaders within your team, those folks, we really need to examine what is it that what is the example and what is it that I'm doing that other people are trying to model their own behavior from. So I hope this gives you something to think about and to sort of look to your own teams a little differently. So I want to switch focus here a little bit and to talk about this concept of mobilizing RVTs and not that it. So of course I'm going to mention my program I developed, but it's more the thinking that I want people to be reflecting on and stewing on. So I've put this on here. Who's tired of these comments? And you can see them on the left. There's a shortage of text. We're not utilizing text. Texts are underpaid. Texts are stressed out. Texts aren't appreciated. The public doesn't know who or what the technician or the technologist or the RVT is. I mean, again, hands up, how many people have heard any of these statements or said some of these statements? I would 100% long time, vintage RVT here. I've heard these over and over and over and over and over through my career. And I'm changing the narrative on it. I'm done with it. And so I want to come up with a new narrative and a new way of talking about this kind of thing. And so when I think about, this kind of concept, I've got these three things here: mobilize, educate, and scope of practice. So I want to be always super clear here. I'm a tremendous and huge advocate for the self-regulation of veterinary medicine. I know it isn't always easy. I've been on so many committees. I really understand what the process is. I support it, and I understand the concept of what we're trying to do as a regulated profession. So this comment here, this column there under scope, anything that I talk about is well within the scope of what we're already doing and well within regulations. And I know that, we have lots of back and forth discussion about should we do this or that, or why do we have to be so regulated? And I'd love to talk to anybody about that over coffee or better yet, over a beer. But I'm talking about here in this concept that we're within the scope. So when I think about the concept of mobilizing or activating your team or engaging with them more, I want to make the first comment that not all techs are created equal, meaning we have a credential, we have an education requirement, we have a diploma, we have all the things, we have an education requirement that we need to meet. Okay, so we know that. But when I talk about not all techs are created equal or have equal interests, it goes back to that strengths-based team. If I have 10 or 20 or 100 RVTs in the room, I would really want to investigate what it is that they're good at, what they like, and how I can help develop them more in that role. So, and I want to find RVTs on my teams that are ready to lead and set examples, meaning that they are so passionate or so nerdy about a certain topic or a certain thing that they're ready to engage in it and they're ready to help others also share an active interest and become competent in that. And to really, I think for as much as we are investigating sort of the dark side of veterinary medicine right now and the troubles, the real significant troubles that exist in our profession right now, I think we need to start putting some study into practices and teams that are very successful and are already embracing a strengths-based team. Then we need to go down, the middle column there is about education. And I put on there, forget about more tasks. We can all do tasks. And we have to, I know that there's things that need to be done, but I really think that our education and our training and our self-development needs to start being more about critical thinking, about objectively assessing things, which is what we do in patient care all the time, about business acumen, about sharing what the business goals are, about actively talking to our own people about how they can impact the bottom line, actively talking about, hey, this is a business. Hey, we're in it for the money. And how do we all impact that? And what is it that we can do in all of us? What is it that we can all do to impact a better bottom line? Not so that we can all get paid more. That would be a side effect of that. But really to be, hey, people, this is what our goals are. This is what we're after. How do you think you can contribute? Who's got a weird and wacky idea that we can put out here that, we can measure and that we can focus on, and then we can think about, and then we can talk about and build on. So those are the things that I think about when I think about education for our teams and, RVTs, but all members of the team. And then, I've got communication in there because I think that's quite important as well. And it goes back to that concept of not everybody knows how to behave on a team. And the good news about communication that absolutely thrills and delights me to this day, to this moment, is that it's a set of skills that we can learn and practice and get better at and get better at and get better at. And I do know, because the evidence tells me, that when we are communicating better with other human beings, our clients, our teams, that everything is better. And people often ask me, oh, you must really just like people, and that's why you do all this communication stuff. And I do like people. Of course I like people. But the number one motivator for me is that the reason why I took the study of communication to the level that I have and that I still do is for one reason. And it's the same reason that I got into veterinary medicine 32 years ago when I went into my program, is that the evidence showed me is that when we communicate better with each other and with clients, patient care gets better. That's the number one driver for me. Yes, I love people. I love talking to people. I'm a communication nerd. I love all that. But there's one motivator still for me, the same motivator that put me in this profession in the first place, is that when we communicate better with our clients, with our teams, patient care gets better. And that's replicated over and over and over in the evidence in human medicine and veterinary medicine. So it is worth educating people to communicate better. And then, of course, I've got scope there that whatever jurisdiction you're in, you should take the time to really, get a sense of, to get a sense of what it is that you can do, like what it is that is, what is the status of regulation or in your jurisdiction, and to really go at it with an area of interest. And I have to, applaud and appreciate, again, in Alberta, but I've also participated on national and international boards around veterinary medicine, that it's about taking an active interest in finding out what's going on, not because I want to be mad at it, because I want to figure out how I can work within it. And if I need to ask the questions, I want to develop relationships so that I can ask those questions. We have to understand our current status and not be afraid of it, and not be afraid to ask the questions. And I think going beyond the concept of utilizing, to start having some different levels of thinking around our teams and what we're going to do. And when I think about scope of practice, when I think about regulated veterinary medicine, it's up to us as professionals to evaluate the risk, like we do every damn day with our patients. So evaluating risks about what I want to change or what I want to do, it's about evaluating the risk to me as a professional, to the profession as a whole, to the clients, and of course, always to the patients. So I think it's worth knowing what the boundaries are, even if we push up against them a little bit and ask the questions. That's, to me, how real change occurs, is not because I'm going flat out and saying, no, I'm never doing this, or I'm going to do it this way anyway. It's about learning about it in a way that I can affect some change. So the training, like I said, this is where I think our teams, we need to focus, and leaders, you need to focus some time, energy, and money into this. This is not something that you can get in a 1-hour webinar. It's not something, it takes a bit of a deep study. The concept of critical thinking and how that applies in communication and in our interactions with people, business. I said there, it's not all about the money, but yes, it is. We have to, as a team, it's not just telling people to be okay with giving those invoices and those estimates. It's about talking about real strategies, about how we add value and what the value principle is to every single thing that we charge on a line item. So I would love it if every day teams talked about how they could increase revenue, and not the typical way, which is, hey, everybody, cut your costs, don't work overtime, and do more stuff. That's not what I'm talking about. I'm talking about how do we all utilize our strengths, not utilize our people, utilize our strengths and our skills to add value to that and increase what's going on in the business. Because I think this was something I did not know for many years. I certainly am learning it at a higher level running my own business, but how interesting thinking about business is when it's presented to me in a way, it's like, well, what do you think you could do? How could you contribute? Got a great idea? And how would we measure that? What's the accountability? What do we do if it fails? That kind of thinking, I think the teams can be involved in. They don't have to see every single spreadsheet and every, the cash flow, or, but I think we can involve our teams a lot more than what we do. And, communication, obviously, I think everybody needs more training and communication, plug for BS. But really what I know to be true is that better dialogue, less drain on our people, more energy, more joyful work, better care, better profession. That's what that's what I know to be true. So I talked about scope of practice, generating some really great dialogue about what is the scope of practice, what is the professional risk, how do we minimize risk, how do we mitigate risk, which is, again, something that we do every day in patient care, and to really apply it to our scope and what it is that we're doing. And find your path through current legislation and support change that generates creative thinking versus this is an issue that I want to hit head on. I want to think, how do I generate creative thinking? And I think about Dr. Carolyn Brookfield, who is the artful science of creativity, and she does some really amazing work that she's really starting to encourage the veterinary profession to be creative thinkers and to be innovative, not just hit an issue on the head and hope that we defeat it. So I want to talk, I guess I should go back to here a little bit. I'm going to give an overview of and a little bit of background about what mobilizing RVTs is. Obviously, it's going to sound like a plug for the program, but I want what I want it to be is a plug for different thinking. And so mobilizing RVT, I talked about that concept of how do we engage RVTs at a different level? How do we try something that's a little bit different, but still within the scope? How do we how can we engage RVTs in a little bit different way and still address things like the public doesn't know who we are, we're getting underpaid, we're not being utilized, all those things. So I really try to think about all those. So mobilizing RVT, you can look at it on the website. It's a 5-day program where we're trying to support and educate RVTs that if it works within their practice, that they can start helping out by seeing some wellness vaccine appointments for dogs and cats. Now, the thing about it is not to replace the veterinarians, not to go outside of scope of practice, not to go out on their own, open Becky Taylor's RVT Clinic of Awesomeness. We do wellness vaccine appointments. It's not about that. It's about mobilizing these RVTs, giving them additional skills and enhancing and refining their communication skills so that they can engage with clients in a meaningful way, adding value. I don't ever really care if a person takes my program and they ever vaccinate a dog or a cat. I had to create something that would entice people to come and get better at communication. If you want to know the real truth, that's what it is. I needed a context of which to attract people in the veterinary profession. So we put it around the concept of a wellness or a vaccine appointment for dogs and cats. And you can read all the details about it on my website or ask me or phone me and talk to me directly. But the concept was, how can we take this group of professionals, and you could apply this to any person on your team. How do I take this person, whoever they are? In this case, it's RVTs. How do we look at the skill set that they already have? How do we engage with that at a higher level? How do we innovate thinking? How do we push the bubble just a little bit so a person can create some discomfort and say, I actually think I could increase my skill here? Because part of skill acquisition, as we all know, is some discomfort around the awkwardness of I'm not really good at it yet. And so this whole concept of mobilizing RVTs was about how do we increase their skill, competence, confidence in the realm of communication, specifically dialogue with clients and within their team, so that they can be more effective, so that they can engage with clients on a higher level, so that they can actually provide a level of service or enhanced level of service to what the veterinarians are already doing, so that the clients are bonded to the practice, so that people can feel like they're served. And at the end of the day, patient care gets better. So those are all the motivators. And there's all kinds of challenges, but it's a 5-day program. And the emphasis 100% every single day is on the role of dialogue and communication. And we add the context of a wellness vaccine. And folks that have taken this program are working in their practices in a whole bunch of different ways. And I'm going to share, I've recently done a survey with all of the participants. I think there's 88 or 90 RVTs that have done this program now from all across Canada. I asked them for their insights, and I'm going to share some of those. And I haven't shared these with anyone yet. So this is the first time that this has been out there. About what successes they've had, how is it that they're working with, and the RVTs that are using this in practice are using it in a variety of ways, always within the scope of practice, always with the collaboration with their veterinarians, always under the direction and supervision of the veterinarian and the regulatory body of whatever jurisdiction that they're in. So I want to make that real clear. So some RVTs are seeing wellness appointments from top to bottom all on their own. Some are sharing the responsibility and starting the appointment, ending the appointment with the veterinarian being in. Some are not seeing vaccine appointments at all, but every other part of their communication with clients has gotten better. Discharges, admits, leading teams, mentoring other things, or mentoring other students or other RVTs or TAs or whatever it is. So this is not a one and done. They take the thing and off they go and they start poking vaccines into dogs and cats everywhere. It's not what it's about. But the thinking of it is, how could we do something more engaging by adding skill, competence, and confidence to a group of people that already have such a great base level of skill? So here's how, when I asked how these things are being implemented, and these are straight from the RVTs themselves. So I think we sent it out to 80 people, and we had 25 people respond back. So very good response rate. This is not a formal research project. This is an informal post-program survey. So just looking at all these things, using the communication tips I've learned to make sure that clients feel heard. Haven't fully integrated it here, but we're initiating it. Using more open-ended questions while getting a history during appointments, empathy statements, confirming understanding by repeating it, not apologizing for costs. Woohoo! Seeing more wellness exams and being more utilized as an RVT in our practice. Starting RVC, so this is people, how they've implemented it. Started wellness exam program at the clinic, bettered my communication skills. 1 day a week at the clinic where I do vaccine appointments all day. Now to take on vaccine appointments, they become busy or emergencies walk in. Still within the scope, still under the direction and supervision, by the way. So far, changing the way I intake and discharge patients, working on developing a plan. These are all the things that I really want. During full appointments alone in the clinic, to be clear, is not meaning that there is nobody else in the clinic. It means that they are doing them alone in the room. Asking open-ended questions, getting as much info, tracking financial information, reflective listening, doing nutritional consults, and having exceptional communication skills. Been focusing on my communication style, not to be judgmental, and started RVT appointments and using communication skills. So these are the things. This is how this thing is being implemented. But again, it doesn't matter to me if you're taking interest in this program. This is about engaging your people in a way that is speaking to their strengths and talking to what it is that they can do. Here's some of the challenges, of course, keeping up with demand. This is not new. I hear this every team that I speak to, every time I run one of my own programs. See if this resonates with you. We're too busy. We're so busy. We're busy. Everybody on the planet of Earth, it seems like, is very busy right now. So keeping up with demand is one of the challenges. Being required to try to do these tech appointments along with all the other things that they're doing. Spreading the team a bit thin as I'm trying to do my own appointments. And then the veterinarian doesn't have an RVT supporting them in practice. Some have had no challenges so far. Finding the time to collect resources for clients to utilize for the appointments. And talking over and collaboratively with their veterinarians about how they want medical records to be done, for example. So a few of the wins that they've been having: helping more patients, being more personable, communication skills. I love that new pets and clients ask to book specifically with me because I can spend more time, feeling accomplished. I love this one. I recently had a very upset and frustrated client that I was able to listen to, apply an empathy statement, and in turn find a solution. Enjoying communicating with clients, not a daunting task. Deeper connection with clients, which I never thought I would enjoy. And it's the connectedness, by the way, with clients and the relationships and the trust that we build that adds value, that will mitigate the, I can't believe it cost this much. Renewed interest. Some have not had any wins yet. This example here is a dental intake. She, through her communication skills, found out that the person had a real concern about anesthesia because of previous pet. And at the end, she told me she was impressed, that it's so much value, and definitely was an encouraging moment that her veterinarian was seeing the value of that. Open conversations, clients are thankful, freeing up my doctor's time. These are all the wins. Again, whether you do this program or not, this is about engaging your people and finding out what they're good at and building that. So for who's leading who, this is my ask to all of you that are attending, is finding strategies that are building culture. I'd love to change the culture that's happening right now in veterinary medicine, which is really around the very serious concern around burnout and fatigue and these things that we are facing that are so hard. And I think we need to start really engaging with our teams in ways that can help find solutions or creative thinking about it. And I want to really encourage people that if you're thinking of trying to impart some change, if you've been stewing about cultural change, if you want to make change in your practice, if you think, oh man, I want to do this mobilizing RVT concept, whether you do the program or not, is that it means change, and change requires time, effort, and resources. Too often people think change is a one and done. This is, it's a model that we need to look at. And we, my business partner Sage has a model, did a lot of work in change implementation, and we got to look at who's involved. We got to look at their gauge for, does anybody want the change? And I could put this whole process in front of our whole veterinary profession and ask these same questions. We need to look at our ability to tackle it on. Do we have resources? And really, when I think about change, it's a spectrum. It goes from, I have an idea, I think we need to change something, all the way through to it becomes business as usual, and we're not even talking about it as a change anymore. This is what I'm hoping with the concept of mobilizing RVT, with engaging our team. Oh, we had this great idea. We were going to work on a strengths-based team and ask people what they were doing, and it's a great idea. All the way through gauging the change, socializing the idea, all the things that we need to do in a change process, all the way to the end where people are like, there's no change. This is business as usual. When we're talking, because it's been implemented so well, and the change has actually been activated all the way to the end when people don't even think it's a change. That's what I really want us to be after. And, we have to, folks, all of us, we have to invest wisely to improve culture, lead change, and communicate better. And that, for everyone here, this is an investment of time, energy, and resources, which means money. I think all of us need to spend more time listening and getting the perspective of other people, and to really embrace this concept of the very best investment any business can make is to invest in their people. And I don't mean send them away to gillions of dollars of courses and things like that, but it means that we are taking an active, engaged look at our team and investing in them professionally and personally, and looking at development. But know in your soul that even doing that is a change and requires the time, effort, and resources that change deserves and is required to. So I know we're at the end of our hour. We've got 7 or 8 minutes left here. I'd love to open the floor for any comments, or if a person wants to go off mute, if they can do that and ask a question, or I'd really love to hear your thoughts on what we talked about here today. I'm absolutely wildly passionate about veterinary medicine and the teams and what we're doing and the amazing work that all veterinary professionals do. I still am in awe of it. I work in these veterinary practices, and I have the same, I have the same awe that I did when I first walked into a veterinary practice gillions of years ago to take my pets for care. So I'm a huge fan still of this profession and of the people in it. And that's, I think we're getting closer and closer and closer to sort of altering this little bit dark narrative that we're in right now. And I think we can do it through investing and being really involved in our teams and building that. So that's my end. I would sure love to hear from people, and want to take a minute to really sincerely thank the CVMA for this opportunity, and thank all of you for taking an hour out of your day to join me on this webinar.
Thank you so much, Becky. We've got a few questions in the chat.
Sure.
The first one is there a mobilizing RVT clinic scheduled for the near future?
Yes. So you can check our website. We have our next one is in November, and I think we have maybe 5 spots left in that one. And then we'll be releasing our 2024 dates probably by the end of October here. So that is what we're doing. And fun fact, we've done a documentary on mobilizing RVT, and it will be released to the public at the end of October. We're doing a watch party and a release at CanWest Veterinary Conference hosted by the ABVMA. And then it will be released. So I'll be sure, if you sign up for our newsletter, please, and you'll get all the details for it there. But all of the information about our programs are on our website, bscommunication.ca.
Wonderful. So the next question we have is, how do we convince the old vets to implement the things that you've been talking about in this presentation?
Yeah, I love that there's old vets. I don't know. I think I'm an old tech. So I guess, my answer is always the same for this, is to spend the time having a great dialogue about it, and to really ask, one of the most powerful things that we can do when we're up against somebody that is in disagreement, or that we feel maybe doesn't want to engage with a new idea or whatever, is to ask that person's perspective, and to do so in a really skillful way. So if I'm talking to, in this very specific example, a veterinarian that maybe you wonder wouldn't embrace this kind of a thing, my goal would be to really go in there and find out more about where and why that comes from. And I would use those types of questions. I've been thinking about this mobilizing RVT program. What are your thoughts on it? What is it that you're the most worried about? What do you think would have the greatest impact on you? Why? What is causing you to think this way? What are your feelings around it, specifically in regards to how it would impact you, the clients, the patients? That's the skilled dialogue that we all need to really engage with, especially in a conflict type conversation where we maybe are going to have a conversation with someone that isn't in line with our way of thinking necessarily. So I always think in those situations, the way I go about those things is to really actively and accurately understand their perspective, so that when I can demonstrate understanding and listeningness and empathy for what they're saying, that then when it's my turn to speak, they will be as invested in hearing my perspective. But I have to go at it with a sincere attitude of curiosity and interest. It's a hard conversation to have sometimes.
Thank you. So another question we have here is, do you have a different word or term to use instead of task list?
I don't know. Because I know there's, I know there's tasks to be done. When I think about even my own team and the teams that I've worked on, I think about roles, responsibilities, contributions, challenges. The list of tasks just goes on and on. I mean, again, I don't want to say that those are not useful things. Of course they are, especially in training and things like that. We need to know what's the checklist of things that need to be done. But when I'm talking about a person's contribution to the team, to the practice, to the revenue, to the whatever, I want to think roles, responsibilities, creative thinking, accountability. So if it's truly a list of tasks, I think it's totally fine to call it a task list. If I'm talking to somebody about their roles or their contributions, or how they want to affect change, or how they want to, how do they want to achieve their goals, and to talk about that, that's a different thing. And I think the two are very separate. Tasks for sure are a part of our everyday, no question. But I think there's another part of our team equation that we could spend some time on with our people.
Great. Thank you so much, Becky. I think we're going to have to wrap it up there. I will mention that you can download a CE certificate on our website. I've sent the link in the chat. And I'm going to hand it over to Josie to do the final remarks. Thank you both.
Just wanted to say thank you, Becky, for the informative webinar. I myself have sticky notes with some of the things that you've said, so that was awesome. We appreciate your time and your expertise.
Thank you.
And also thank you to everybody for joining us today. A reminder that the webinar for today will be available on CVMA's YouTube channel by the end of next week. And you can find more resources, such as social media posts in this year's videos, under the Animal Health Week page on CanadianVeterinarians.net. Thank you so much, and have a great day, everyone.
Thank you so much.